Good afternoon. Thank you all for being here today on Wednesday, Hump Day, on the Wednesday before Labor Day. I do want to just briefly welcome Dr. Dobbs and Mac here today. They're with me and going to give their reports, but I did want to tell you some of the numbers that I am looking at. We had 781 cases today. That's in comparison to 904 on last Wednesday. One of the things that we've learned throughout this pandemic is to not get overly excited on the weekends when the numbers are particularly low, and not to get overly excited in the middle of the week when the numbers are particularly high. I think it's critical that we look at things over a 7-day moving average. I also think it's very important that we compare like days, because we know that on the actual daily case reports, there can be wide variability based upon when private labs are turning their numbers in. You all know that I spend a lot more time looking at the Department of Health website and their data as it relates to the date of onset of illness, because that gives us a much better indicator. But it is also something that we should all look at and consider as one of many data points, total number of cases. And so we were down about 15% this Wednesday compared to last Wednesday, which is positive movement again. But when you look at our 7-day average, this is even more important. Our 7-day average yesterday was 625 cases. Today it's 608. That obviously compares to the 1,381 cases 7-day average that we had on July the 29th. That is a very positive movement in the right direction. We also know that we had nearly 1,250 Mississippians hospitalized at the peak. And that includes, by the way, just for your own knowledge, the fact that that includes both confirmed COVID patients and suspected COVID patients. That's two lines on that chart that we all look at. I know I see some of you shaking your heads. Yes, you know what I'm talking about. And that number was down to under 800 yesterday. And so, again, that's very positive movement. Total number of patients in ICU beds in Mississippi peaked at 337 in late July and early August. That number was down below 200 at 196 yesterday. Again, very positive movement. And then, of course, we have talked about ventilators. The first few months of this pandemic, the number one word said across America and across the globe was, do we have enough ventilators? Everyone was scrambling. We know in Mississippi in excess of 600 ventilators available. We currently have 117 patients on ventilators throughout Mississippi, and so that equipment will not be a factor in us accomplishing our goal. Let me remind all of my fellow Mississippians, our goal is not to eradicate or completely eliminate the virus, although we would love to be able to do so. We know that's not a realistic goal or a realistic expectation. But what is to ensure that every single Mississippian that gets the virus, that can get better with quality care, that they actually receive that quality care. We know that the biggest mitigating factor, for instance, on ventilators is not the number of ventilators we have in Mississippi, but the number of people within our healthcare space that have the ability to operate those ventilators. And so we're going to continue to monitor that. But all of these, both leading and lagging indicators, are all very positive for our state. I mentioned the R0 number a couple of days ago. It continues to decline. It was at 0.88, the most recent number I looked at, which tied us for the second best number in America. Again, tied with Rhode Island, and that's something that is very good. That's a leading indicator. That should suggest what's going to happen in the future. But I say all of that, all of those numbers, because of what we know is coming up this weekend. We cannot give up the gains and the improvements that we've made over the last 2 months with Labor Day weekend coming before us. We know that we need to be especially cautious going into Labor Day weekend. I'm asking every single one of you to be on your guard. We can make a difference if we commit to it and if we work together. We can continue to see declining numbers which will allow us to get back more towards normal. But please, this weekend, have a cookout in your backyard with your kids, and only your kids, the ones that you live with. Relax. Take it easy. But please do your best to avoid huge gatherings. And if we can all do that, we can get through this safely. Now, I know that this is not an easy ask. I know that this ask is not fun, because we as a people in our state, we're people. We like to get out and have a good time. We like to see our friends and our neighbors. But the next 8 to 10 days are critical if we're going to continue to see a decline in both our leading and our lagging indicators, if we're going to continue to see a decline in total numbers, if we're going to continue to see a decline in hospitalizations, the next 8 to 10 days are critical. One other exciting announcement that I want to make today is working with the Mississippi Development Authority and the monies granted us by the CARES Act from the federal government. We are launching our $19 million effort to provide more PPE and more testing monies to assisted living facilities, ambulatory surgery centers, Alzheimer's and dementia care facilities, and other medical facilities outside of hospitals. This will be a reimbursement program as is allowed for under the CARES Act. I do believe it's going to have a wide financial impact for that industry, and my greatest hope is that it allows for increased testing and increased resources to help more families see loved ones in nursing homes, but also to be able to do so in a safe, responsible way. We know we have to protect those most vulnerable amongst us from COVID-19. We know those that are older are more vulnerable and more susceptible to this virus. We also know those that are living in many of these facilities that have pre-existing conditions, that have comorbidities, are more vulnerable than others. But we also know that loneliness is a powerful disease. It can be deadly, and we have to do everything we can to guard against that as well. Each of these facilities has the option at this point in this pandemic to provide some safe ways for visitation, but hopefully these resources can help them get what they need to make it safe and possible if the facilities have not already been able to do so. If you're an operator looking for more information, you can get it from the Mississippi Development Authority at mississippi.org. Thank you to everyone who has worked so very hard to make this program possible. With that, I'm going to turn it over to Dr. Dobbs, who's going to give us an update on our numbers. Dr. Dobbs?
Thank you, Governor. So today, we're reporting 781 new cases and sadly 33 additional deaths. In long-term care facilities, we had 4 additional deaths with 158 active ongoing outbreaks. If we look at our total case burden for the state thus far, 84,365, with total COVID-related deaths of 2,526. And just for a fun exercise, I pulled out a couple of excerpts from death certificates, so you could understand a little bit how we determine if it's a COVID-related death. I mean, there's been a lot of crazy theories out there about how this works, and so I'm going to read a couple of them to you, and you can figure out if you think it's a COVID-related death or not. Acute respiratory failure, secondary to COVID-19 and pneumonia. That's a COVID death. COVID-caused respiratory failure and pneumonia. Acute respiratory failure from COVID-19. It's a COVID-related death, obviously. Pneumonia from COVID-19. That's a death from coronavirus, no doubt. But it has 2 entries on the death certificate, right? Heart disease with COVID-19 and myocardial infarction was not counted as a COVID death. Cardiopulmonary disease, heart disease, diabetes with contributing factor COVID, not counted as a COVID-related death. Cardiopulmonary arrest, heart failure, COVID-19, and hypertension, not counted as a COVID-related death. We take it very seriously and look into this very closely to make sure that it was COVID that caused the organ dysfunction, especially respiratory dysfunction. Just because you have coronavirus, even if it is part of the disease process, and perhaps we're over-conservative, but the people in Mississippi who have died from COVID that we're reporting definitely died from coronavirus. So please, let's put that silliness to rest. Other stuff to talk about today, we're very excited to be offering N95 masks to school nurses. They will be available at the drive-through testing locations on the same schedule as the free testing for teachers. That's starting immediately. So we've released that to the Department of Education and through other channels. So very happy for us to supply that for school nurses only, so that when they're taking care of ill children, or if they're doing nebulizing procedures like meter dose inhalers or breathing treatments, that they can have that extra measure of safety. Other things worth talking about today with schools. This past week we had a total number of new teachers with coronavirus, 138, new students, 280, 21 new outbreaks. We have a total number of teachers under quarantine of 532, with 3,730 students on quarantine. Certainly, we're going to continue to work closely with colleges. Dr. Byers and I will be visiting with Jackson State University today and University of Southern Miss tomorrow. We're sad to report the death of a healthy child between the ages of 1 and 5 years old today. This child died of coronavirus and the MISI, the multisystem inflammatory syndrome, over the past couple of weeks. Very sad, and a powerful reminder that even though most people get over it just fine, even young, healthy people can die from it. And everything that we do to prevent transmission in the community is an act of love that prevents transmission to others and can lead to serious outcomes. Going into Labor Day, would like to reiterate the governor's plea. Please, let's not repeat the errors of Memorial Day and the 4th of July. We had massive increases in cases and deaths because we got carried away. Please, let's have a relaxing Labor Day weekend. Do stuff mostly outdoors, and then keep it small groups, preferably within the nuclear family. This is not the time to be having big family gatherings or big social gatherings. So please follow these warnings. And then the last thing is we are reporting one new West Nile virus case in Montgomery County. We still have other things going on. We've only had 3 reported West Nile cases this year, which is pretty phenomenal. But it is important to make sure that when we're outdoors, we remember to wear mosquito repellent and be careful with long sleeves if you can on those early morning and afternoon, early evening hours. And Governor, that's all I have. Thank you.
Thank you, Dr. Dobbs. I meant to mention this when I started. I do want to say it to those that are watching today. I did, we spent a lot of time the last 6 or 8 months working on coronavirus and the issues that surround that. And some days I felt like we spent literally 24 straight hours doing it. I do want to just mention that I did have the opportunity a little after noon today to spend a little time on the tarmac over at Jackson International Airport, in which we had members of the 114th Military Police Company, the War Eagles, that have been in Kuwait and in the Middle East for the last 9 months, return back to Mississippi. We want to thank them for their service, thank them for what they've done for the United States of America, and let them know how proud they have made their fellow Mississippians by serving. They did a fantastic job, and it's sometimes good in these challenging times to see the big smile on people's faces. And for those men and women, I could even see their smiles through the mask that they were wearing on their airplane. So welcome back to the 114th Military Police Company. Thank you for your service to America. And with that, I'm going to turn it over to Mac, himself a former military man, and let him talk through from an emergency management perspective.
Roger that. Thank you, Governor. I want to report out on Hurricane Laura. We had our SAR, search and rescue team that just returned from the ground zero, really. They accomplished some great things, sir, and just want to let you know that they were operating out of Cameron, Grand Chenier, more than 300 structures. They did assessment on them while they were there, numerous food and water and medical responses. That team had to go into locations that were impassable by other means, so they got there by boat and any other way that they could. They also provided intel to the state of Louisiana about where ground zero was, because they were one of the teams that went in there and found out where the initial impact came in and did that. They conducted air recons with Louisiana National Guard teams. They established landing zones all over the area for the National Guard teams as well, and they provided interoperability to other teams that were operating within Cameron Parish. So that team did an outstanding job. Very proud of that search and rescue team. And they come from all over the state of Mississippi, and they combine into one unified team and effort that goes into when things are bad, and they make it the best that they can. So that was a great deployment for that team. Our air assets with the Mississippi National Guard still are on standby. Possibility of them needing to rotate in and out with other air units that are there, but we stand by ready for the call and ready to provide those services. So that team did a great job. Also, in closing out, we had about 4 counties that reported damages. Adams, Warren, Adams County, Warren, Sunflower, and Wayne. We had approximately about 6 public roads that had major damage on it, and about 13 homes had anywhere from medium to light damage. But we continue to get those reports in from the county. So Mississippi stood well on that threat. I'm also to report in on the tropics today. I am very pleased to say that Tropical Storm Nana, that happens to be a lot of grandmothers' nicknames. It's headed toward Mexico and will track through Central America at this time, and we don't feel like we're going to get any effects from that. That would be hard to explain to some of the grandchildren, I'm sure. We have Tropical Storm Omar has taken a right, and it is going out into the Atlantic. But we are watching 2 other storms coming off the west coast of Africa and between the Windward Islands and West Africa, about a 30% chance over the next 5 days. And we have another tropical wave over this about 60% chance of forming coming off the coast as well. It is that season. We've talked about it many times here, and we want to echo it here. But we're watching that for the state of Mississippi. To follow up on the the municipality and county emergency relief program, we continue to process applications, but if you look at the numbers that are 82 counties and the Mississippi Band of Choctaw Indians and approximately 362 municipalities in the state, I have 54 municipalities approved, 37 counties, and 6 others, whether they be state or nonprofits. So we have put out the call through the Municipal League as well as to the Association of Supervisors. Those applicants that are coming in, we're able to get those funds actually programmed and allocated. We're up to almost $3 million that we've got slided and ready to go, and it's a very easy process, but we still need more applications from those counties and from the municipalities. We put that out in our weekly call yesterday to the counties, and we started getting phone calls in about 15 minutes afterwards. So we continue to ring that bell that the opportunity is there to provide funding for those municipalities, for their emergency workers and others, and we continue to make good effort there, but we certainly would like to see more this early in the game, but some people wait till the 4th quarter, and we'll get that done, and we're going to be processing those throughout the end of this month. So we have time. But I'm telling those municipalities and counties, give me more time on the front side, and I can get the money programmed to get it going. FEMA is approving all those things that we're doing so far. On the very last thing to report out on, you see Dr. Dobbs and my boss here, Greg Michelle, the executive director of MEMA, here every time with the governor. So it's always health and always emergency management. Well, there's 34 areas of concentration that FEMA put out yesterday to us in emergency management that have grants, that have monies, that have funding, and have programs. And that's anything from agriculture, arts and culture, science, health, homelessness, mental and behavior health, migrant workers, you name it. There are 34 concentrations. That's going to be on our website by the end of the day today, and it will list every federal agency that has funding outside of what we normally operate in emergency management, which is the Stafford Act. So that, when you look at protective measures, that's what I'm under right now. Category B, protective measures. That's the way we're moving and navigating through this actual disaster. But there's so many other resources that FEMA coordinates and MEMA coordinates through those state levels getting that done. And for an example, at the very last is Health and Human Services has just provided us with notice as of yesterday, 1.8 million community masks are on the way for schools. And that's going to be about 900,000 for adult size and 900,000 for youth. So we just don't go through FEMA for everything. We actually look at those other federal agencies that are out there that provide things outside just the emergency protective measures that we're actually working under. So just a big reminder there, and thanks, Dr. Dobbs, having great news today. Keep up the great work, sir. And Governor, that's all I have.
Thank you, Mac, and I just want to say a couple of things, and then we'll open the floor to questions. Number one, as Mississippians, we know what it's like to suffer from major hurricanes. Let's keep our friends and neighbors in Lake Charles, Louisiana, in our prayers. I know I've spoken to so many of my fellow Mississippians that have made runs over there, taken supplies, served food, cooked food. Stay safe while you're over there. Wear a mask. Be smart. Stay socially distanced, but we're going to step up and help our friends in need. Another thing I'll mention, particularly with the announcement that Mac just made with HHS sending us 1.8 million masks for our kids and adults in our K through 12 schools. Regardless of your political views and political affiliation, I've worked through Democrat administrations as well as other Republican administrations, and I've got to give this administration significant credit. They have worked exceptionally hard to make sure that the flow of information continues. It's not always this easy for the administration to be proactive in their information distribution. And so, Mac, thank you for mentioning that. Please be willing to go to the websites. I mentioned www.mississippi.org for the Mississippi Development Authority program that we put in place for the healthcare providers for the PPE and testing reimbursement program. And also, don't be afraid to go to the website that Mac mentioned, that Mississippi Emergency Management Agency's website, to get opportunities for other grant programs that by and large are funded through the CARES Act. Not entirely, but by and large. The federal government spent trillions of dollars already, and we certainly have the opportunity to benefit from that as well. So with that, I'll open the floor to questions. Emily?
Unrelated to the pandemic, the State Flag Commission today recommended a flag design that has a magnolia on the center of it. I just wanted to ask your opinion about that design.
Well, I've seen the flag, and I want to first say to those 9 individuals that served on the Flag Commission that we appreciate their service. I think in my conversations with them, they probably have heard from a lot of their fellow Mississippians and gotten opinions from a lot of their fellow Mississippians, and have a little bit of an idea of what serving in public office is like in 2020. So I do want to say that I appreciate their service to our state for doing that. We're going to look at the flag and as a state come together and make a decision as to whether or not we want that to be our flag in the years to come. And so obviously it's got some traits that are very positive. I certainly appreciate the fact that the magnolia is on it. We think that it's very important that it has much like our state seal, which I fought for in the Mississippi legislature during my time as lieutenant governor. It's got the words "In God We Trust," and so I think they did a good job. It's I think a well done flag, and I think the people of Mississippi have a great opportunity if they choose to do so to implement this flag.
Thank you, Governor. I guess this is a two-part question. First off, do you think that the shutdown, through this pandemic has hurt, many businesses to the point where they may not be able to recover? And as the debate for more stimulus packages continue, in Washington or right here in Jackson, what can you tell those business owners with what is coming and how the government will still keep trying to help them, because we're not out of the woods? Right.
Well, we are not out of the woods. We know that. If we were out of the woods, we may not be sitting here right now. And we went through a spike in July and August, which led us to make some very challenging decisions to protect the public health. But the good news is that we were able to see significant reductions in overall transmission rates in Mississippi in July and August without a total economic shutdown, without closing businesses. Now, we've had to put restrictions on a few, none of which am I happy about. But yeah, I think you're exactly right. I think we're going to look back on 2020, and there are going to be a lot of small businesses that don't make it. And that's horrible, and I absolutely hate it. And that's the reason that we worked with the Congress initially on the CARES Act funding, and then ultimately with the legislature to get our Back to Business program up and operational and funded. And and try to get money in people's pockets as quickly as possible. But I don't think there's any doubt that there are going to be businesses that some of whom benefited from the PPP program out of the federal government, some of which participated and benefited from the Back to Business program of our administration, and even some of those are not going to make it. And so my heart aches for them, but I am proud of the fact that when you compare Mississippi and what we've been able to do in our economic recovery and compare it to most every other state around the nation, we are seeing a significant comeback economically, and that's something that is a testament to the resiliency of the people of our state. There's no doubt that there are going to be some small businesses that don't make it. Every single year there are small businesses that don't make it. But this year, probably more than any of my lifetime, a higher percentage of small business owners were facing challenges that they never faced before. And some of those, sadly, were because of government action. And so I'm hopeful that as we move into the fall, as the numbers continue to come down, if we'll just get through these next few weeks and continue to drive transmission lower and lower and lower, we'll continue to be able to get back to more and more normal environment. CJ?
Governor, this is for Dr. Dobbs, and it's a two-parter or follow-up, however you want to treat it, Dr. Dobbs. But I want to ask you about private schools and reporting these numbers. We have evidence that shows that one private school in Tunica County reported 12 cases to parents on August 18th. It appears those numbers were included in last week's update. They are not included in this week's under cumulative. In fact, it says there are no cases in Tunica County. At first, when we saw that, it looked like there might have been a reporting issue. Can you kind of clarify that for us as to why those numbers would have shifted like that?
Yeah, that's a good question. A lot of this is just process stuff we're kind of working out. So it is a requirement that we get the numbers on every school. Many of the private schools are sending them directly to us. Many of them wanted to send it through the MAIS and as their broker of information. And so we don't have that updated information from MAIS yet, but we should have it shortly. We did get it last week, and we value that partnership and expect for that. This is all sort of an evolving process of kind of working out the kinks, and so it absolutely will be there. Yeah.
So it's not a breakdown in communication, and as far as
Well, it kind of is. I mean, just kind of delay.
But it's not a failure report on their part, I guess.
Yes, sir. Yes, sir. Yeah. Not a failure.
So my follow-up is, have you seen? There's been some concern from parents that, and we actually asked for clarity last week from the health department on whether that health order that you issued that required reporting applied to private schools.
Oh, yes.
Because there was concern that parents were saying, well, it doesn't look like they are reporting. Are you knowing of any that are specifically not reporting at this point, and can you speak to the requirements?
We've had several ask the question, but not any that have seemed like that they're not going to share the information. Some of them really do want to go through MAIS because there may be smaller schools and appreciate that sort of structural assistance. So just kind of working out the kinks. Thanks.
Yes, sir.
This is also Dr. Dobbs. In Harrison County, y'all are saying that there is a total students quarantined or 424.
Okay.
Is that just mostly based around the one school that is that shut down periodically?
It probably would be, just thinking about the numbers. That would be probably the single largest one. But obviously, there's a lot of other kids who are quarantined as well.
And just so, everyone obviously knows this, but let me just point out that in terms of total number of students quarantined, every single day there are going to be kids that are coming back to school because they have endured their 14-day quarantine, and every single day more kids are going to go on. And so you're not necessarily going to see a cumulative number of how many have been quarantined over the life of the life cycle. But just keep that in mind those numbers are going to change because unlike, for instance, total number of cases, the total number of people quarantined every single day, there's those that come on and those that come off.
And let me say something about the quarantine too, because I've had some parents talk about how hard it is on their kids to be quarantined and they're missing out on stuff in school. And I would encourage everybody to look at the front end of this. Not be aggravated at the quarantine, but aggravated at the reason for the quarantine. And the reasons for the quarantine, by and large, are unsanctioned, potentially, illegal based on executive order, social events where people are transmitting coronavirus. This is a mechanism where we can keep kids from perpetuating the transmission in schools. The quarantine is to contain, right? Every kid who's on quarantine is not going to get sick, and I think that's a little bit of understanding of, hey, my kid's not sick while I'm in quarantine. It's like, no, it's because we want to prevent that next level, and your child may become sick, or your child may be asymptomatically a spreader and perpetuate it to other folks. So it's an unfortunate thing that we have to do, but if we have the proper planning in the schools, we can absolutely minimize the number of kids who have to quarantine. And if we really cut back on the really unnecessary social stuff that's going on, we're going to be a lot better shape.
And just to add to that, and I think it's important, is, as we came through August, the bulk of schools have reopened to some extent. And through August, the bulk of the cases that occurred in our school initially came from outside of the schools. But as we move into September, more and more of the transmission that we see in our schools is likely to come from either transmission in the schools, which we've not seen a lot of, or from transmission that occurs from unnecessary social events. Maybe it's a big dinner that a senior class has, or a big dinner that the sophomore class has, or the sophomore class of football players goes to someone's home and has a dinner with 30 or 40 people. So again, I know that everyone wants complete normalcy, but we're not there in 2020, unfortunately. And so we've got to be smart about it. And so just be aware and think as parents, does it make sense for me to sanction this in my own home when I need to assume that if there's a group of 100, there's probably 1 or 2 people, maybe 3, that have it and potentially could spread it. And if we think like that, I think we'll make better and more wise decisions. And again, no one's perfect in this. I get it. No one's going to be perfect. But the more people in Mississippi we get to do closer to right, the better off we're going to be as we move into the fall. Yes, sir.
Now, students are going to have to quarantine periodically. What are your concerns for that in and out of students, in the classrooms, and now they have to go quarantine for 2 weeks, and then they come back maybe like a month later, another one of their classmates gets it, they have to quarantine again?
Yeah, no, that's a real concern, and but a lot of it is engineering. If you're in a school and you're never within 6 feet of another person, you never have to quarantine under any circumstance, right? So let's just, as much as we can, separate the kids, and the more we can separate them, you can't do it all the time, but it's 6 feet for 15 minutes, and if we can keep it 7 feet for 2 hours, technically you're in good shape. And then the mask thing is going to make a big difference to prevent outbreaks. 'Cause outbreaks is another thing if you have an outbreak in a setting. So proper planning is going to be really important, adjustments to plans, and then just making sure kids who might have it don't come to school so that we don't keep those cases going.
Yes, sir.
Thank you, Governor. How are you guys holding the private schools, I guess, accountable for reporting accurate numbers as opposed to the public schools?
It's the same. I mean, it's the same process. I mean, we'll get the numbers. We're doing case investigations on every single kid. We prioritized our case investigation and contact tracing to school-age kids and college kids. So we will get that information. There's going to be a backstop, right, like a double check. But we need the schools to tell us because it's more real time, right? And the outbreak information about they have that information about who's where and all that kind of stuff. So it's super helpful for rapid response and working with these guys. They've done a fantastic job. I spoke to Jackson Prep headmaster. They have a fantastic plan. I think I haven't talked to every school, but by and large, all the schools I've talked to, both private and public, are taking this very seriously, and that's going to make all the difference.
I think that's an important point to make here. Much of the way we have managed through our public schools is our ability to through executive orders and through statute to affect their calendar. We don't have that ability with the private schools, but what we do have is not only the responsibility but a requirement and the authority to protect the public health of those individuals within those buildings, and so the authority to make sure that we're getting participation by both public and private is there. But the good news is, like is the case in the general population, the vast majority of public and private schools and their administration care about their kids, and they're working with us. And so it's not something that I'm personally concerned about. Are we going to get exactly accurate numbers every single week from every single school? Is there going to be a transmission error, or is somebody going to make a mistake? Sure there is. We know that. But it's not going to be from a lack of effort, and we've certainly seen that so far. Schools across the state are interested in protecting their teachers and protecting their students, just like we are. Yes, sir.
Thank you. This is a question for you, Dr. Dobbs, but Governor, if you want to add to it, that would be nice. Being the state health officer, sir, how do you best argue these campaigns like Mask Off Mississippi by Foster? Like, what's the best argument you can give for people who are trying to make calls to remove masks, and how vital is it, to keep them on with Labor Day coming up?
It's so important. I do think that we've made a false sort of process and how that we look at this. It's not masks and shut the economy and no masks and open the economy. The right answer is the little things that we can do to protect people, a little bit of space, smaller groups and a mask, and let's have a vibrant economy, right? That's the sweet spot that we need to be in. And so just really trying to make people understand that we're for a vibrant economy. I mean, there's nothing that's better for public health than a good job and a good school and a good education. And so that's part of public health. So we're for that. We'll just try to keep pushing the message, because the data's there that it helps. Look what's happened in Mississippi over the past month. Look what's happened in the counties where we did the mask ordinances. And there's more to that than just the mask. It's the spacing and some stuff and some decisions, but it works. I guess that's the main thing.
Yes, sir.
Governor, and this is for Dr. Dobbs as well. Certainly encouraging data. More than 2-month low for 7-day average of daily cases in Mississippi now. Nearly 2-month low in terms of total hospitalizations. Those are certainly encouraging. But at the same time, we know that the next wave is coming, with more schools starting back in the next couple of weeks. And of course, we also know that the typical start date for flu season is next month. So can you speak to that and the potential stresses coming up for the state's healthcare system? And I think just getting too complacent maybe is one of the things that when we see these encouraging trends, it can happen very easily.
I hope we learned our lesson. I really do. The start to school has actually been better than anticipated. The seriousness that our educational leaders are taking this has really been encouraging. I would like to ask our parents to please support your school leaders. Right, they've got your children's best interests at heart. But of course, we're worried going into the fall with flu. So first off, get your flu shot now. It's time. September through October is when CDC and we think it's a great time to go and get your flu shot. And just keep your eye on the prize. And we'll have increases invariably, but if it's a slow, manageable increase, that's so much better than these sort of stratospheric sort of, rocket type increases that we see. And we're working with the hospitals, but it's not that hard to overwhelm the healthcare system. And then we're all going to suffer.
I would just simply add that as we move into the flu season, for instance, if we will all continue to focus on the mitigation efforts to keep the coronavirus from spreading, it very well may help us also have a flu season that is not as bad as it might otherwise be. Because if we all wear a mask and if we socially distance, if we continue to do the little things to protect us from the coronavirus, it could also have positive effects with respect to the flu. And so I just encourage all of our folks across the state to continue to work hard. We are now in the month of September. Obviously, we started planning for this early this year. First case on March the 11th. We've been doing this a long time. There is a lot of fatigue. I hear it. I see it. And it's understandable. I'm fatigued as well. But what we are doing now is working. The numbers are coming down, And there's a reason they are coming down. They're coming down because we have less transmission in our communities, and we're having less transmission in our communities because we're all working so very hard. And that's something I hope will continue. Renee, you?
Jackie Ledger has a question.
Right.
Hey, Governor, when I asked 2 days ago about Tamika Drummer, the woman 12 years into a life sentence for 2 ounces of marijuana, you said you weren't familiar with the prior crimes that had made her a habitual offender. Her past crimes include voluntary manslaughter in 1992 and aggravated assault in 1998. Still, do you think a marijuana possession case of 2 ounces should ever result in a life sentence? And have you had the chance to look any further at her case?
I have not looked any further at her case. Manslaughter is a pretty serious crime, obviously. As I mentioned a couple of days ago, I am not currently considering pardoning this young lady or anyone else in our state. I'm focused on other items at this time. But we'll certainly continue to review it, and we'll make decisions as we press forward.
Jennifer Kay, Bloomberg Law.
Hi, thank you, Governor. Can you confirm whether Mississippi has received communication from the CDC to do whatever the state can to get vaccine distribution sites operational by November 1st? And would that be a reasonable date to expect any vaccine for COVID-19?
The only thing I can tell you is I have not personally spoken with anyone at the CDC, but I will tell you that in my most recent conversations with the coronavirus task force, with the president's team, with Dr. Birx, there are certainly encouraging data coming out of the clinical trials, and we as a state are going to do everything we can to be prepared as soon as those vaccines are approved to make them available to those individuals who receive that priority. But I have not personally spoken to anyone at the CDC and been given a date at this time. Maybe others have, but no.
Blake with Daily Journal's question.
Yeah, my question is for Dr. Dobbs. I wanted to see if there was any additional information that you could share about the child that died from COVID, like maybe what part of the state they're from or any other details.
No, I'm sorry. We're going to limit that bit of information just to try to maintain anonymity. But a healthy child between 1 and 5 died from coronavirus, but also had that multisystem inflammatory syndrome. And in addition, we are going to post information on the total number of cases. I believe we've had 7 cases of that MIS-C and 2 deaths from it. So, and again, those are pretty much young folks that are going to get that.
Hunter Dawkins with the Gazebo Gazette.
Thank you, Renee. Thank you, Governor. Governor, this question is for you. Tomorrow is one of the first NCAA college football games, and it happens to be in Mississippi in Hattiesburg. The first question is, will you be down there? And the second question is there any, caution from you, because both teams have numerous kids in the state of Mississippi, and that's kind of setting a good example of the mandates and things that you've been setting forth.
Yeah, thank you, Hunter. I appreciate that question. We and my team have been in constant contact with the folks down at the University of Southern Mississippi. I have the utmost confidence that they're going to run an operation tomorrow which allows for the game to take place and for it to be done in a safe, responsible way. And yes, I do plan to attend the game on the campus of the University of Southern Mississippi tomorrow night.
Thank you, Governor. I'd like to ask you about a post you made on Facebook. So, laying out some of the numbers, you called this the China virus. We've seen a lot of viral videos in the past of Asian Americans being bullied or stereotyped when it came to this phrase. I'd like to ask, why did you insist on calling this the China virus? I don't think I've ever heard that from you before.
Well, I've said it multiple times, and what I would say is I don't condone anyone from any Asian Americans or otherwise, or anyone from the People's Republic of China who happen to live in the United States. I don't condone anyone bullying them. I don't condone mask bullying either. I think those who choose not to wear it, not to wear a mask, should not be bullied by their friends. I don't think we should make fun of them. I think we should encourage those to wear masks. It's certainly a mandate in our state. But look, the reality is that had this virus not escaped from, however it occurred, from the lab in China, I don't know that we'd be having the kind of conversations that we're having all day, every day, and that's just a fact. And the reality is, the people who are from China, who are in America, are not our enemies. The people of China are not our enemies. But there is no question that the Communist Party of China certainly is no friend or ally to the United States of America, and that's just a fact. And I believe it, and so I'm going to continue to harp on that if and when it is necessary.
Jack from Thurnlander has another question.
Governor, there was a part of my question I asked that you didn't respond to. I wanted to know if you think it's ever appropriate for anyone to get a life sentence for the possession of 2 ounces of marijuana.
If that were that individual's only criminal act, I don't think that 2 ounces of marijuana should justify a lifelong sentence. However, I will also tell you that someone who is convicted of 3 different felonies, that is a serious problem. As many of my law enforcement friends, and by the way, let me say that I couldn't be more proud of the law enforcement, the men and women in Mississippi who put on the uniform every single day and go out and protect us. There is no question that they have come under attack in this country recently, and I saw it firsthand recently on a trip out of state. So I want to thank the men and women in Mississippi and the men and women across America who wear the blue. Thank you for what you do to keep our state safe. But there is as many of them in law enforcement remind me regularly, if someone is convicted of 3 felonies, doesn't mean that they have committed 3 felonies in their life. It means that they've been caught and convicted through a court of law. They've had their day in court. And so, no, I don't think a single act of possession of 2 ounces of marijuana should justify a life sentence. But I do think that habitual offenders have to have statutes that deal with habitual offenses. I think that's a perfectly legitimate thing to do. Now, we can certainly talk about what those sentences look like, but I certainly think that those of you who want to paint habitual offenders and look at their sentence based upon only one simple act and ignore the other acts that occurred, I don't think that makes sense.
Thank you. This question is for Mima. Sir, can you go back to the 1.8 million masks we're apparently getting sent to schools? Is this just going straight to schools, or how exactly do superintendents get it? Can you talk about that again, please?
Yeah, I can just, we've made contact with the Department of Education earlier today through our emergency coordination officer from that department, and we're filtering that information up because I got the information yesterday. So it's on the way. We expect it by mid-September, somewhere over the next week and a half or so, since we got the information, and we're working with the Department of Education on how do we do that distribution. You know, we automatically already are delivering to 9 separate districts, all 82 counties, pod distribution sites that we run every day. We've reported out on those numbers, over 270,000 miles so far. So we certainly have the capacity at MEMA to do that, but we want to find out what's best. What's the population of the schools, how many administrators, how many teachers, how many students that they have, so we can actually help them distribute that in a more efficient fashion.
These masks again?
So it's Human and Health Services, federal government. and they're designated this is their school reopening program. And it was 125 million nationwide. So Mississippi, we got our cut off our capita, and that was about 1.8 million.
And we appreciate that too, by the way. I just want to, I want to point something out here, and I've tried to say this every press conference we've had for the last 7 months, but I just want to, again, on behalf of all of our fellow Mississippians, and if you're watching today and you have the opportunity to see someone that works in state government or works for the Department of Health specifically or MEMA, thank them. The logistics of what we're doing is quite frankly incredible. I asked Dr. Dobbs and his team to make testing available for our teachers. And what they did is they put together a plan to do that, and they've done tremendous work. We have over 1,000 campuses throughout Mississippi. It's not like we can just show up on 1,000 different campuses with teams of 10 or 15. That take 10 or 15,000 people tomorrow. But we can develop a plan, we can rotate, we can have the people in place to do the testing, and Dr. Dobbs and his team have done fantastic on the testing side. But the logistics of putting out 1.8 million masks, again, delivering and distributing them to campuses throughout the state, over 1,000 of them, is real work. It is hard. It doesn't just happen. Nobody can just snap their fingers and make it happen, including the governor. And so I am proud of these men and women at these two agencies particularly, but our men and women of the National Guard who have supported us, and all of our agencies that have supported these efforts. And while there's not a lot fun about wearing a mask, there's not a lot of fun about doing a lot of things, there's also not a lot of fun in some of the things that we've asked our public servants to do in 2020, and I want to personally thank them. And all of us as Mississippians should not only thank them, we should pray for them, and know that we all have our challenges in life, at home, etc. But these men and women are making huge sacrifices, and for that I am exceptionally thankful.
I wanted to ask about the health department budget. Because you signed the state budgets, that most agencies took a cut of 3% to 5% this year. Health department was on the upper end of that at the same time that the health department has faced this incredible increase in responsibilities. Is there going to be an effort to put some more money into the health department at some point during this budget year? And if so, where would that money come from?
Yeah, the Department of Health, the governor's office, and the Mississippi Emergency Management Agency took pretty significant cuts in this year's budget. It's probably not what I would have done in the middle of a pandemic, but my commitment is if the Department of Health or if MEMA, we'll handle our cut at the governor's office. We'll do what we have to do. Although I've got men and women that are working literally around the clock, and I can't thank them enough. But if they find themselves in a situation in which they need additional resources, I think we can work with our friends in the legislature and make sure that happens. Keep in mind there are significant federal resources that are available that we're having to figure out on the fly. But I'm certainly going to be supportive of additional funding should it become necessary for the Department of Health and MEMA. Let me also just say there was a request by the state auditor, Auditor Shad White, to the Mississippi legislature to fund with CARES Act funds a audit of all of the federal monies that are going out. The legislature chose not to fund that. I have alerted the state auditor, and we have been in regular contact. He has the ability to charge the state agencies to do it. He does it every single day. But I've alerted him and other state agencies that I plan to use some of the discretionary CARES Act funding that I have to make sure that every single penny that we spend is audited. I think that's important. I inherited really serious problems at the Department of Human Services, for instance, because the audits that had been done were lacking. And there are going to be people that go to jail because of it. I'm not going to allow that to happen under my watch. And so we are going to fund with governor's discretionary funding what the state auditor needs to do these audits. But yeah, I will support monies that they need. I'll also tell you I don't want to say I told you so, but we talked a lot about the revenue estimate and the way in which they went about doing it with the previous revenue commissioner and the previous state economist doing it without a revenue estimating committee meeting. The estimate, at least in July and August, was way lower than what the actual revenues were that came in. That's positive, and so there's potential revenues to be dealt with there. And all that's because our economy's coming back much stronger than certainly they thought. So,
Governor, it's for Dr. Dobbs. I appreciate the death certificate explanation. I think that, what was shared this weekend best could be described as a misinterpretation of the CDC's information provided that said only 6% died from COVID alone. 94% had, on average, 2.6 comorbidities in play. Can you kind of break that down a little bit for those who will see that? And, we'll just, again, it was, what you said with the death certificates resonated, but specifically, most people have never probably seen a death certificate, may not know the typical reporting process and the definition of comorbidity, quite frankly.
Well, and it's more than comorbidities. If you look at what they said, is it was at the sole cause of death. I would argue that it should be zero. No one dies with one thing, right? So if you have, say, bacterial pneumonia and you have kidney failure, that's two things, right? It doesn't mean that the pneumonia didn't kill you. It just meant that you had multiple organ processes involved. COVID is an organ killer, right? And so if it kills your lungs, if it kills your heart, if it kills your kidneys, that's three things. And so just because you have three things on a death certificate doesn't mean that you didn't die. I have never filled out a death certificate, and I've done it for years until recently, where I just put one thing, right? So I'm actually surprised it's 6%. It seems kind of high. It's a horrible misinterpretation of what that means. And if you look at comorbidities, I just do want to reiterate that the majority of Mississippians have a comorbidity. 700,000 people plus in Mississippi have hypertension. Okay? So does that mean they don't deserve to live because they have a comorbidity? Almost 40% of Mississippians are obese. That's a comorbidity. And it doesn't mean that you're, it's a little bit, I think it obfuscates a little bit the real danger of did they have a comorbidity? Because everybody has a comorbidity almost in Mississippi, unless you're under 30, and even a lot of 30-year-olds have asthma. That's a comorbidity, right? So it's really just a horrible misinterpretation of reality.
Jackie with WHBG has a question.
You might have already answered this, but can you say where the child who died from COVID-19 is from and the race or sex of the child? And I have a follow-up question.
No, we're just going to leave it at the child 1 to 5 to try to protect the identity of the child and the family.
Okay. And for my follow-up question, what would you like to emphasize to parents about this tragedy? A young child dying from COVID, as well as like students and teachers that are in the school system, around children every day. Like, what is the takeaway from this tragic event that happened?
Yeah, it can be deadly. I don't want to get coronavirus. I don't want my kids to get coronavirus because something bad could happen. It's not just a virus that just kind of comes and goes. It attacks your blood vessels. And for kids and adults too, it causes an immune response that can be very damaging, like this Missy thing. So, take it seriously. It's easy to say, well, most people don't get over it. Well, if it's your family or if it's you, that's huge. So just please take it seriously. And it's not like we have to live in a cave for the next year. We just have to do some simple things, is just adjust our social schedules a little bit, wear a mask, stay away from others. That's really all it takes. So please just do the simple things to protect yourself and your family.
Eric from WJSU has a question.
Hey, good afternoon, Governor. I may have missed this a little bit earlier, but if you could elaborate a little bit more on the Mississippi Back to Business program, how many businesses do you know have gotten the relief And then also, with that, I guess that caveat, the legislature, went back and I guess, redid, how would that affect the program?
Yeah, well, thank you, Eric. Appreciate that question. Hope you're doing well today. I actually got a briefing yesterday from our head of the Mississippi Development Authority, and because of the tweak in the language, and I appreciate the chairman in the House and the Senate and the legislative leaders for doing that. I believe we've got approximately 12,000 more businesses that appear to be more likely to receive funding now. Tens of millions of additional dollars going out. We want to get this money in our small business owners' hands, and so I'll get my staff to get you the absolute specific numbers from that briefing on where we find ourselves. But the Back to Business program is seeing more and more businesses get approved. They're sending checks out every single day. And that's a good thing, because we want to keep our small business community thriving and, quite frankly, surviving in many cases across the state. Well, we've been here an hour, and it appears there are no other questions at this time. We'll be back soon, I hope. I want to thank again all of you for the job you're doing, getting information out to our people. I want to encourage, as we go into Labor Day weekend, my fellow Mississippians to continue to wear a mask in public. Try not to have large gatherings for social purposes. We are seeing good things happening in Mississippi. The numbers are moving in our direction, but now is the time over the next 8 to 10 days to really step on it. If we really work hard over the next 8 days to wear a mask, to stay socially distanced, and to avoid large social gatherings, and we can continue to drive these numbers down. We can go from the 1381 that we found ourselves at in late July down below 500. That would be a great accomplishment, and working together, we can make it a reality. So thank you all, and God bless.